A client who is currently receiving occupational therapy services has become unemployed and lost access to health care insurance. The treating OTR has received permission to provide pro bono services to ensure that the client continues on the path to recovery. What ethical principle likely informed the OTR's decision in this situation? The correct answer, I chose autonomy, and the correct answer is justice. The rationale for the answer is justice refers to fair, equitable, and appropriate treatment to others. The client lost access to a required resource, which the therapist helped the client gain access to the needed resource. Question number 2. An OTR is working with an acute care client who has a ventricular assist device. Which precaution is essential when engaging this client in occupational activities? The answer I chose was C, educate the client to receive yearly influenza and pneumonia vaccines. The correct answer was D, avoid disconnecting the drive line to the power source during movement. The rationale for the correct answer is a ventricular assisted device requires a power source. So the OTR can, if you're not careful, the OTR can disconnect the assisted device while the client is engaged in activity. Question number 3. An OTR is providing occupational therapy services to a client in acute care who was diagnosed with a pulmonary embolism. What is the most typical cause of a pulmonary embolism? The answer that I chose was pulmonary edema. The correct answer is deep vein thrombosis. The rationale for it is pulmonary embolism is a common cause of deep vein thrombosis. The other options are not associated with DVT, which is a blood clot. Question number 4. In reading a client's medical chart, the OTR knows that the client has a history of postprandial orthostatic hypotension. What activity precautions should the OTR give the client? My answer was take several minutes in the morning to move from lying down to sitting and then standing after being in bed all night. The correct answer was avoid a positional change from lying down to standing within 30 minutes of eating a meal. The rationale for the correct answer is postprandial orthostatic hypotension occurs when a client goes from laying supine to standing shortly after eating a meal, which causes the orthostatic hypotension. So the client should avoid that. Okay. Question number 5. An OTR is working with a transplant recipient who has recently been discharged from a major hospital. Which type of client would be most likely to develop an infection post-transplantation and require greater infection control measures? My answer was a kidney transplant. The correct answer was a lung transplant. And the rationale for the correct answer is a lung transplant is most susceptible to infection of bacteria germs due to the fact of inhaling. Okay, thank you.